Say there has been an outbreak of measles in your district. The outbreak has been investigated and confirmed, and now the national level has determined a response. As a district manager, you will help implement the response and use the findings from your investigation to develop an appropriate action plan. If you do not respond quickly and manage the response to the outbreak, the disease could spread. Once an outbreak has been confirmed, you must plan a response in coordination with the national level. The response will depend on a range of factors including the disease, risk for spread, available resources, and current national policies on outbreak response. In this video, we will look at the activities involved in planning an outbreak response as early as possible, managing the outbreak, alerting necessary people of the outbreak, searching for unreported cases, and when needed, launching additional corrective measures and immunization activities. Given the urgency of the situation, some of these steps can be done at the same time. First, manage and treat any cases that have been identified in the outbreak. Make sure staff is adequately trained to treat and manage known cases following national guidance. For example, in a diphtheria outbreak, all cases should be treated with antibiotics. As a manager, you may need to provide clear guidelines and hold briefings with staff in affected areas. Also, set up control measures as soon as you have confirmed the outbreak through investigation. These measures are specific to the targeted disease, but generally involve isolating existing cases to prevent additional spread. You should also alert higher levels, facilities, and communities that there is an outbreak. As soon as an outbreak has been confirmed, notify the next higher level of your immunization program and request any necessary supplies or support. Alert health facilities in your area and in nearby areas so they can be on the lookout for new cases. Offer adequate resources for facilities to carry out treatment and preventive actions. It is also important to keep the community informed of the outbreak, explaining which individuals are most at risk and any actions they should take. Clear and concise communication will help ease concerns and encourage cooperation. Search for any new cases of the disease by intensifying your active surveillance efforts. Make sure all health facilities have a clear case definition of suspected cases so they can actively seek and report new cases. During an outbreak, they may need to report more frequently. In some cases, staff may need to search for additional cases at the community level. This may involve house-to-house visits, reviewing out and inpatient registers and medical records, as well as visits to private hospitals, clinics, and neighboring areas. Ensure that surveillance staff investigate and collect data from each suspected case using the standardized disease-specific case investigation form. Continually analyze the data to better understand the extent of the outbreak and to guide response activities. Use data to identify clustering of cases, which areas are most affected, the timing and progression of the outbreak, which populations are most affected, and the severity of the outbreak by calculating the attack rate and case fatality ratio. Also, review your program's surveillance system, particularly performance indicators such as the completeness of reporting, compliance with zero reporting, and timeliness of reporting to identify and correct any potential problems. If appropriate, launch rapid focused immunization activities. Remember that the type of response is determined by national policy. The decision to launch an immunization response is determined at the national level. The outbreak response is disease-specific. For some diseases such as polio, Global policy recommends urgent, large-scale supplementary immunization activities, or SIAs. If immunization activities are needed, consider target populations, which groups and ages are most at risk, target areas, including areas surrounding the ones affected by outbreak, the start date and completion time for campaign, acting as quickly as possible, resource availability, including vaccine supply, personnel, and funds, and a logistics plan that includes transport details and clearly defines responsibilities. Now you are familiar with the key activities in planning an outbreak response.